Well, no, this is still quite old data. This is the sort of data that was available when the drugs were first licensed. That was 10 to 15 years ago. So there's been a lot of data that's been published since that adds to the picture. This is a part of a picture, and we need the unpublished data as much as the published data, but we need to look at all the data so that we can get a real picture of what's going on.
Let me bring in Dr. Keedwell. What is your view in this? Massively overprescribed?
Yeah, I think there is a case for saying that antidepressants are overprescribed at the milder end of the spectrum of depression. I think the main messages to take away from this study, which is welcome although flawed, is that antidepressants should be prescribed for more severe cases of depression, but as it already states in NICE guidelines, for milder forms of depression you should consider talking therapies and social interventions first. And, you know, that's in keeping with my view of depression, really, that there nearly always is a meaning to depression, that it has a social cause, and you need to examine those causes, maybe alongside antidepressant treatment, but antidepressants shouldn't replace that.
But why, in your view, are so many doctors prescribing that?
Well, I think there are pressures, not least because talking therapies aren't really available in the NHS, or very, very limited to a degree, and I think therefore family doctors are to a certain extent under pressure to prescribe. Not only for that reason actually, but also because patients themselves often request them. The busy pace of living in modern life, I think people think there's a quick fix, which is a pill, and I would say that that's often a mistake. But the main thing is, I think the main message is that patients should not panic as a result of these new findings, because this study has been reported in the press in places as Prozac doesn't work, and I think it's important to say it does work for certain patients, and if it's helped you, then I wouldn't rush to stop it. Because you may have a relapse, and I think you should discuss it with your GP.
David, I can see you're nodding there and would second that advice. But I guess the interesting thing here is that people saying it works particularly for people with more severe depression. How easy do you think it is when doctors are prescribing for them to gauge the level of depression that somebody is suffering from and decide which is the best treatment for them?
Depression isn't easy for people to diagnose. You know, it takes experts like consultant psychiatrists to really know about that. It's much more difficult for GPs to assess. But, you know, at the end of the day, what we want is more talking therapies to be available so that...
So you agree that this is a wake-up call for all of those GPs out there, perhaps, who look at the options and perhaps are going with the option of prescribing drugs? I mean, 40 million cases we're actually talking about.
Well, what we need is for talking therapies to be available in the NHS. Where there is no option, GPs don't really have a lot of choice. And so they end up prescribing antidepressants for perhaps milder depression when, as the doctor said, what we want is for people to have talking therapies available to them.
Dr. Paul Keedwell, where do you think this now leaves people in the field? What advice should they be giving people? Should we be asking for this whole issue of prescribing antidepressants to be reviewed by a more formal body?
It has been reviewed by a formal body called the National Institute for Clinical Excellence, and I think that's the place that people should go to. But
do you think this should feed into further work by them?
I think it helps. It helps, yes, because I think what it's highlighted is the rather more political issue of withholding negative data. And we need to be sure that we tighten up the industry under the Freedom of Information Act and make sure unpublished negative findings are exposed as well as published ones.
Okay, Dr. Paul Keedwell and David Bruce, thanks for joining us this evening, gentlemen.
Thank you.